Okay. So my presentation today, I think most of you know who we are. So my presentation today is to talk to you about what we've been doing since March 15th when everything closed down, and who we've been serving and what we're continuing to be able to do, and the need that's out there and how we're addressing it. And then I'd be happy to answer any questions at the end. I also included at the end, just for inspiration, some of where our students are for our first generation students, some of the success stories, because that's an important part of our mission. So from March 15 to October 15 is the data you're going to be seeing. And I'll explain to you who we've been assisting and what we've been doing. So this is a month-old data now as of this Sunday, but we're serving over 100 patients a week. We're providing free emergency dental. We've ramped up our mental health counseling sixfold. We used to do about 10 patients a week with the funding I had, and now we're doing 60 patients a week. So huge need, and it's all in Spanish for our immigrant population here in the Conejo. We have a high school student training program. We have 109 students here in Thousand Oaks, so the rest you're seeing there are in Oxnard. We provided school supplies to 933 different children in the Conejo Valley School District before we started in August. So we did it by the car drive-through. We were already giving out food to over 400 Conejo East County families. And so we just put the school supplies right in the car based on the slips they filled out. It said how many children, what ages. We were able to provide them with what they needed. And then we give out food, like I mentioned, to over 400 families a week. That's about 1,700 people in the families. And that's 20,000 pounds of food a week. And we also give out face masks every week. So that's in a nutshell, in an infographic, what we've been up to during COVID. So our services include primary care. So we're still doing healthcare, both telemedicine and in-person care throughout the pandemic. We did have to have our students stopped coming, our high school students stopped coming until we got in the right zone within the county to allow more than 10 people in a room. And then we've been doing chronic disease management because, as you all know, probably when you have diabetes or high blood pressure or any other chronic issues, which is the primary population we're serving, you're more at risk of dying of COVID and having complications. So we want to make sure that our patients can keep their condition under control during this pandemic. So that it was the time we couldn't even think of closing because we had to be there to make sure people would stay well. So we continue to have case management. Our case management refers to 211, helping with rental assistance. We've actually had a whole team doing rental assistance since the city offered this wonderful program. Unfortunately for our clients, many of them, didn't know this was coming. Nobody did. So they took loans with loan sharks or special loan groups that have high interest rate loans in order not to be homeless. And now they owe $9,000, just for an example, with a high interest loan or a family member that they're going to have to pay back, trying not to become homeless. So they came to us, but we can't. The rental assistance program is only good, of course, for giving it to the landlord. And so that there was no chance for them to get relief from that debt. The other challenge for many of our clients was that they are renting a room or a garage or a couch or some situation where they're not on the lease. So they are not able to apply for the rental assistance because of that as well. So those are the two main reasons that many of the people we actually worked with could not apply. And then we did help some apply, of course, as well. And then our heart healthy food distribution is something our students have helped with all throughout the pandemic. That's outdoors. We bag up brown rice, lentils, pinto beans, oatmeal, only heart healthy foods. A lot of food programs give out a lot of food that's going to create a lot of new patients for us, which we don't want to do because they're getting Cocoa Puffs and ramen noodles and macaroni and cheese in a box. And I'm just looking going, oh my God, they're going to have high blood pressure and diabetes soon and obesity. So we only offer things that are going to really actually promote health and not inflammation and health issues. So fruits and veggies, and then so the staples I mentioned. We're really fortunate to be able to give out grocery gift cards for a number of weeks throughout the pandemic. I would say we've given out probably about $50,000 worth of gift cards over this time period for about $25 a gift per family, in helping for diapers or other kinds of soap, shampoo, whatever other things we aren't giving out that they might need. We've been a partner with Assemblywoman Jackie Irwin to do free antibody testing here in Thousand Oaks. We've antibody tested over 500 people. She's asked me if we can be a site again. So in December, they'll be coming back to do antibody testing again. For those of you who don't know, that's a good thing. You want to have antibodies. That means that you have some immunity to COVID-19 because you already got it or you got exposed to it. They're doing a study with UCLA Health to figure out how long antibodies last in your system. So we're part of that study. So that's been a really great partnership. Another partnership we have is with the county for COVID testing. We just become a COVID testing site recently. So whenever they need a spot, they can come to our clinic on that night, set up their van and offer free COVID testing, because our population is one of the ones that's kind of afraid to find out if they have COVID because they don't want to lose their work. They don't want to be told they can't be in their housing. Because they're overcrowding often, or they're living in housing that's, where they would be infecting other families. And so they really don't want to know. So we've been trying to encourage people to find out to decrease the spread. And now, of course, we always give out free flu shots, which we just did to over 300 people. So we're very involved in trying to keep people well and safe during the holidays. And as you can see, our food distribution, which we always have done for the last 15 years, we're a pantry site with Food Share, has increased a lot. So we used to give out for 100 families. Now we're giving out to over 400 families a week. Before it was just our patient families. So we would tell them to eat healthy. They'd see the dietitian and they'd be told, you got to change your diet, but then they couldn't afford to. So we began many years ago to provide them with fresh fruits and vegetables, brown rice, beans, all those things. So we just ramped that up to a whole new level because so many people lost their jobs and needed the economic support. And so we have a drive-through the afternoon and evening of our clinic. And we give out whatever we have, we give it out. It's amazing, just a nonstop of people. We've served over 42,000 people so far as of a month ago. So that's been really successful. I thought you might like to see a video of it. I'm hoping it's going to work. We'll see how it goes. Okay, I'm gonna quickly, oops. I'm gonna just unshare for a sec. Let's see. Well, maybe I'm not showing the video. Oh, there we go. I'm going to share it with you in a sec here. I'm going to take you back. It's only a minute long. So that is what we do every week since March 15th. It has been quite an operation and been very rewarding. It's amazing how many people need support right now. But we've been able to, that's how we gave out the school supplies. That's how we gave out the 500 free dental kits. That's how we're doing a lot of what we're doing right now, and it's working out really well. So, yeah, so we keep thinking, oh, this is the last month. Oh, 2 months from now it'll be done, but it doesn't look like it's ending anytime soon. So we just keep going, and my team has been amazing. Oh my gosh, they've been working so many extra hours and so hard, and they are the most dedicated bunch of people. I'm just very, very fortunate to work with them. And so that they're the ones that are making this happen. And we have a huge, huge group of volunteers, both youth and adults, who come every week and make this all what it is, both in the healthcare side as well as food insecurity and other social determinants of health. You know, our whole thing is social determinants of health. So addressing all the economic supports that are needed. This is who comes. So this is our medical data from our electronic health record system. We also have data for our food, but I thought you'd be interested in the medical side. So most of our patients are from Thousand Oaks and Newbury Park, as you can see. The next biggest group is Simi Valley. We had 3,658 patients since March 15th to October 15th. Most are women. Most are between the ages of 19 and 63, which is uninsured age. Really tough. The people that we serve are cannot be insured or cannot afford insurance in most cases because they're working poor. They're paying 80% of their income for rent or more. And this is industries they come from. So most are domestic, house cleaning, agricultural, restaurant, of course, and hotel are a big one for construction. And also domestic help like a nanny or a caregiver to the elderly are other employment sectors. This is for East County. West County, we have different ones. So it's a whole different graph. The majority of people have diabetes and high blood pressure, and it's about double the national average. So very high risk for COVID-related problems, complications, death. So really, really important that we keep their blood sugar and blood pressure under control. And as you can see, we have started telemedicine. We do telemedicine whenever it's possible. So for example, if it's a diabetic patient that just needs a refill on their meds, they don't need to come in for that as long as they're stable. But if there's somebody that's a new patient, and we've had 40% new patients at our clinic. So that's about every week we're getting about 40% new patients. They need to have an initial visit. They need to fill out paperwork. So we need to get their vitals. And this is the top areas of health services that we're providing right now. So you can see the numbers there. Diagnostic tests we pay for labs. Labs are free, medications are free, everything we do is free. So the idea being we want people to have early access to care so they don't put off care, then we can't really help them anymore. Once they need dialysis for their kidneys because they failed or their vision's going because their diabetes is out of control, we really, we need to catch them early so those problems don't become limiting to their families, their economic situation, and their work. And our high school program, which we're very proud of, this kind of shows you the breakdown of who we're serving. So somehow boys just don't interview or are not as many as girls. Girls are really out there and want to intern at the clinic. So you see 67% female. That's pretty typical every year. But the boys we have are fabulous and amazing. And then for Spanish speakers are always at least about half of our population that we bring into the program, and they are usually typically their family members are using the clinic for their care. And most of our youth are first generation, whether they're from Spanish speaking country or China, India, or other countries. Many first generation students at our clinic who are immigrants. They'll be the first to go to college in this country. And these are the high schools that our students come from. With the majority coming from Thousand Oaks, Newbury Park, and Westlake high schools. And I thought you might like to know very quickly where some of our kids have gone that have come from extremely challenging backgrounds and have been successful, because all of our students are amazing and are doing great. We have a student that gets an 8-year med program straight from high school every single year. We have a couple I've just written letters of rec for this year, and hopefully one of them will get selected. But these young people grew up without a car in one room, with their mother typically cleaning houses. with lots and lots of barriers and challenges to success. In every case, we had to give them a computer so they could actually show what they knew at school once they joined our intern program. So the young person, Luis, on the left, graduated from Newbury Park High. He's at USC right now. He's going to be a senior next year. And he just got an internship for the summer with Goldman Sachs. And he is the person who made all my beautiful infographics this summer. He did an internship with us through USC, worked with us to do data management and analytics. So he's on our board of directors. Yesenia, who you see in the middle, Moore Park RN, she is working now. She's graduated, and she graduated from Thousand Oaks High School. She graduated from the nursing program, and she's working at Community Memorial Hospital now. Jennifer Palominos from Thousand Oaks High School. She's the one with, it says Children's Oral Health Program. She went to Northridge and then and CLU. And so she has a master's in public health, and she works for the county now. And to the right of her is Yvette Flores. She went to Newbury Park High School. She came to us as a 9th grader just to translate for her parents who had lost their job. They worked in a factory in Newbury Park that got that closed down. And so they became our patients. And she saw kids like herself volunteering in Blue Scrubs, and she wanted to know how she could get involved. And so she joined our team in the 9th grade, joined the IB program, decided all of a sudden, she said that she wanted to go to college too, like they were planning to do, and that she saw kids like herself doing. And she not only went to college, she got into Stanford. So she got a full ride to Stanford. From there, she got a full ride at UC Berkeley, got a master's in social work, and she has been working in a nonprofit in Richmond for about 5 years now. And she's taking off to finish her licensure. So she'll be a licensed MSW. So, and her sister ended up as a nurse. She made her sister come and volunteer when she graduated, told her she needed to fill her shoes, and her sister very resistantly did, but ended up deciding to go to college as well, and did in the Bay Area. Student on the bottom left, Melissa, she went to Thousand Oaks High School. She got a scholarship to University of Notre Dame. And she now is doing incredibly well at a healthcare tech company in Minneapolis, and is really loving her work there. Student next to her, Megan, she went to Westlake High. She also got a full ride to Stanford, and she worked for a while. Then she did a post-bac program, and she's now in a medical school physician program in Colorado. She just first year. Student next to her, Denise, is also from Westlake High, and she went to Cal State Channel Islands. And so I tried to show you a few: community college, state college, private college, to get a variety, because we have lots and lots of students. So these are just a few sampling. Denise is a special story because she had no way she was taking the bus to get to Cal State Channel Islands, and one of our board members donated their car to her, so she would have a way to get back and forth and be more involved at Cal State Channel Islands, and then do her rotations once she got in their nursing program. And they didn't select her originally for the nursing program, and I contacted the director to find out why, and she had just not filled out her application right about what she had done at our clinic. And once she did, we sorted that out, she was in. So she almost didn't make it just because she didn't understand what she had been doing it at our clinic. So her experience at our clinic made her be selected. You know, it's extremely competitive right now to get into nursing school. And she is working at Community Memorial Hospital right now as an RN. So that's just a few samplings of your local kids and what they're doing. And we're so proud of them. And there are many, many more stories like theirs. And they are great role models for the next group of students, seeing that, oh, I live in one room and I don't have a computer and I don't have internet and I can do it. They did it. I can do it too. So making sure that all kids have the chance to reach their dreams. And in saying that, I had one donor this year who's so inspiring. He was doing really well with his Apple stock. And so he said, I want to share all the money I'm making on Apple stock. So I want to buy 15 students a MacBook Air. And so 15 of our students at the clinic who had no computer, so they went from no computer to a MacBook Air. And they were just really, really thrilled. So that hopefully will carry them through college. So what we're doing next, like I mentioned, they're having a free COVID testing. They're going to let us know the dates. And we just said, whenever you want to do it at our site, absolutely. That's awesome. We have free antibody testing December 9th with Supervisor Jackie Irwin in the Oxnard Fire Department. We have our adoptive family gift distribution coming up December 14th. That is where families with a lot of challenges and needs are adopted by members of the community or groups to help them economically. So from the mother, the father, the whole family. And then for all the kids, we have a toy distribution that will be December 16th this year. You can see some of the pictures below. So on the left are the adoptive family, where you're seeing a big pile of presents. That was from somebody at Los Robles, a department from Los Robles who adopted this family with this excited little child. And so that family got their wishes for the holidays, kind of like Make-A-Wish. And then on the right, you're seeing the toy distribution. So every child gets to select a toy. And we have over 600 children that got toys last year. And very much thanks to Francine, because Toys for Tots ran out of toys and told us just like 6 days before our event that they would not have any toys for us. And they were originally promising us all the toys. So Francine did her magic and we had a fabulous, fabulous event. And not only were we able to give toys to the children in the Conejo, we had enough toys left over to give about 100 toys to the children at our Oxnard clinic as well, which was really awesome. So that's what's coming up. And we have gotten some great press coverage. It's one of the articles that came out during the pandemic, and we had another one for our school supply distribution. And you can learn more about what we've been doing during COVID on our website. We have a website page and just our regular activities of what we do. This has been incredibly challenging times, and we are just adapting every day, just like everyone else, to make it work and make sure our families are not without support and care during this really tough time. They're the same families that really got hit hard by the fires. And here we go again. It's really very, very hard on them. One thing I'm happy about is COVID in a positive way has made it aware at the school district level, for all levels, that how many kids were struggling before the pandemic with internet access and computers, and they were being given assignments they could not complete at home because they didn't have a computer and internet, or they just had their phone. And now everyone knows it, but before it was kind of a hidden thing. So I'm kind of glad, because before they were still having their homework only online that they had to find, or they had a YouTube thing they had to watch, or so that's a positive maybe that's come out of this. And there's a few positives. That's one of them maybe. Any questions?